Hi and welcome everyone. I'm Abby Jones with USAID Center for Water Security, Sanitation and Hygiene. I want to thank you so much for joining us for this webinar hosted by USAID's Water Communications and Knowledge Management activity. Today's webinar will explore the durability of outcomes achieved under USAID Mozambique's Strengthening Communities Through Integrated Programming, or SCIP, which closed in 2015. It's the sixth in a series of ex-post evaluations conducted by Social Impact on USAID-funded water and sanitation activities that have closed between 3 to 10 years ago. Previously evaluated activities are marked in blue on the map and are available on USAID's Water Sector Knowledge Hub, globalwaters.org, while a series synthesis is currently underway. Our intention with this series is to understand the durability of outcomes achieved through the agency's water and sanitation investments, and most importantly, why those results were sustained or not, to ensure the agency is poised to help partner countries on their journeys to self-reliance. Today's speakers will highlight findings from the SCIP ex-post evaluation, as well as how USAID Mozambique's programming has built on this work in the years since the activity closed. Today's presenter is Kari Nelson, a technical director from Social Impact who supported the evaluation. USAID Mozambique's WASH team lead, Maggie Northman, will serve as a discussant, and Holly Dents, a monitoring and evaluation specialist with the USAID Water CKM activity, who leads this ex-post evaluation series, will also join the Q&A. But before we get started, I wanted to flag a couple of things. First, we really would like to hear from you and would like to include your voice in the conversation. So please ask questions, share comments, even challenge our ideas and findings. To do so, you can use the question panel on the right side of your GoToWebinar player to share at any time during the webinar. But note that questions won't be answered until we hear from both the speaker and discussant. I'll be organizing and grouping the questions and comments in the meantime. Second, I want to flag that you can find the SCIP evaluation brief under the handout setting, as well as slides from today's presentation. For the full evaluation, please head to globalwaters.org. Third, today's webinar is being recorded and will be uploaded onto Global Waters in the coming week. And then finally, if you're having technical issues, our webinar technical team will do their utmost to assist you and will monitor the question box for any issues that you bring up. So now I want to turn things over to Kari to run through the evaluation, and welcome. Thanks again for joining us.
Thank you very much for the introduction, Abby. As Abby noted, my name is Kari Nelson. I'm a technical director with Social Impact. I'll be leading today's presentation, and my colleague Holly Dents, who's been our central lead on the ex-post series, will join us at the end for the Q&A. Just to go through a little bit the flow of today's presentation, so I'll provide a little bit of background on the SCIP activity. We'll talk about the evaluation design a little bit, and then we'll really dig into the meat of the presentation for today, where we'll discuss the findings and recommendations from the SCIP evaluation. As Abby noted, this evaluation in Mozambique of the SCIP activity was the sixth of our ex-post series. So this is the last of six. And you see on the map the different types of activities that were covered through the ex-post series. In the case of Mozambique, this was a rural wash activity. And all of these activities were, ex-post evaluations were conducted between 3 and 10 years after the end of the activity. A little bit of background on the SCIP activity. So this was strengthening communities through integrated programming. It was implemented between 2009 and 2015. One of the unique things about SCIP was that it tried to take an integrated approach across multiple sectors. So it tried to integrate health, HIV/AIDS, WASH, rural enterprise components, nutrition, agriculture, to really try and make an integrated impact on communities in the Zambézia and Nampula provinces. Now, something to note as background for our evaluation, so though the activity was implemented in these two provinces, our ex-post evaluation only covered the Zambézia province. Within Zambézia, there were two primary implementers. World Vision implemented the activity in 10 districts, while International Relief and Development implemented it in 6. A little bit about the interventions that were included in the SCIP activities. So the overall objective was to increase hygiene practices and use of clean water and sanitation facilities. And to achieve this, there were essentially what we're calling intervention packages implemented across all of the communities where SCIP was implemented. So first, there's the sanitation and hygiene package. And so this included establishment and strengthening of community health committees, training of those committees and other behavior change agents in CLTS and FAST. There's triggering and promotion of hand washing with soap and tippy-tap construction, and then post-triggering support as well. And then in addition, in a select number of communities, and this was a relatively small number compared to the total number of communities where the activity was implemented, so the smaller number of communities was selected to also receive water components. And so this is the WASH package. So it's all the same interventions under the sanitation and hygiene package plus water interventions. And so these interventions included setting up and strengthening water committees, constructing or rehabilitating water points with a financial contribution from the community, and then training of local water technicians and spare parts suppliers. Through our evaluation, we tried to address 8 evaluation questions. Now, the first 6 on water, sanitation, and hand washing are fairly similar across the series. So for each of those kind of subsectors, water, sanitation, and hand washing, we tried to look at what is the current status of both infrastructure as well as practices. And then we tried to look at what are the factors influencing sustainability of that infrastructure and practices. And then, particular to the SCIP evaluation, we added a couple of additional questions on resilience and integration. So the first question here was, to what extent did SCIP's inputs to the community health committees and integrated approach impact sustainability of WASH interventions? And then the second question was, how have SCIP communities been impacted by significant shocks regarding WASH? And so just as a note, so data collection for this evaluation was conducted middle of last year. And so this was several months after the cyclones that had hit Mozambique. And so we were particularly interested in looking at how communities and particularly WASH infrastructure and practices had continued or not after those shocks. In order to answer these evaluation questions, we conducted a mixed methods evaluation. So we did 990 surveys. We did structured observations of 46 water points, 500 latrines, and 822 hand washing stations. And then we did water quality testing at 30 water points. And just a note here why we didn't do water quality testing at all 46, that's because some of them did not function. And so we did the water quality testing at all of the water points that were functional and actually producing water. And then in addition, we also did 43 key informant interviews. Now to dig a little bit into the findings and the meat of the presentation for today. So starting off in the water sector. So first off, just basic functionality. So we found that this was roughly on par with similar settings and what we've seen in the other similar evaluations in the ex post series. So there, as I mentioned, there's 46 water points that we included in the evaluation. All of these were AFRIDEV water points. 65% of them were functional at the time of our visit. Through our survey, we heard from respondents that generally where the water points were functional anyway, that people did believe that there was year-round service. So they weren't significantly impacted by seasonal shortages or wells drying up, those types of issues. And indeed, that was similarly confirmed when we talked to community leaders when doing the observations, who reported that all of the water points that were non-functioning had broken down, as opposed to wells drying up or other types of issues. In terms of overall reliability, so in our direct observations, we found that 60% of the water points did have some sort of notable repair issues. So this could have been leaks, it could have been broken handles or other pipes or other parts on the water points, but 60% of them did have some sort of repair need. And just to kind of emphasize this point yet further, we heard similar in the household survey that the primary concern with the water points was the need for repairs as opposed to other types of potential issues like seasonality of water or other types of issues. In terms of the quantity of water being provided by these water points, overall we found that this was largely sufficient or more or less as we would expect. So on the left-hand side there, you see a comparison between the industry average in terms of flow rates for similar types of pumps, and then the average that we observed, which was right about 0.25 liters per second. And so you see it's the average we saw is right around what we would expect to see. And then in the survey, when we asked people if they felt that they had sufficient access to drinking water, on the right, you see overall 72% agreed and said that yes, they had sufficient access to drinking water. But what was particularly interesting here is we disaggregated these findings between communities that had received a SCIP water point, so those wash package communities, and the communities that only had the sanitation and hygiene package. And so in communities that had received a SCIP water point, we found 83% of people said they had sufficient access to drinking water, as compared to 70% that had not received a SCIP water point. And those differences were statistically significant. While water quantity appeared overall sufficient and acceptable, water quality, however, was not. Unfortunately, we found that 47% of the water points that we tested did test positive for E. coli, and 90% tested positive for fecal coliforms. So obviously very disappointing results in terms of water quality, but we did unfortunately find that people felt that the water points were still providing drinkable water, despite the fact that when we actually tested it, they were not. And this finding is fairly consistent with what we've seen in the other ex post evaluations, where there does seem to be kind of this incongruity between kind of communities' perceptions of water quality and the actual reality. Moving on to basic water access. Overall, this was relatively low. So overall, 41% of household surveys had basic water access per the JMP definition. One of the things that's particularly interesting in looking at this statistic is looking at it by poverty levels. So one of the things that we added in this ex post evaluation was the use of the Progress Out of Poverty Index. So this is a index created by Innovations for Poverty Action and a consortium of partners that is calibrated for each particular country, and it's extensively tested. And basically, it's a short set of 10 basic questions that can be added to surveys to not directly measure consumption or income or poverty, but can give you a likelihood. So these 10 items are the things that are most highly correlated with poverty in that particular country. And so basically it gives you, it tells you the likelihood that a household is above or below particular poverty lines. So in the case of Mozambique, we disaggregated between those who are likely below the national poverty line, which is $1.50 a day, between the national and international poverty lines, which is between $1.50 and $1.90 a day, and then those who are above the poverty line, international poverty line, excuse me, which is $1.90 a day. And so, and you'll see throughout the findings where it's relevant, we have disaggregated the findings based on these groupings. And so the first one here on basic water access, you'll see that those households who were the poorest had the lowest access to water. So only 29% had basic water access. For that middle group, around 44%, right around the overall average. But then those who were likely above the international poverty line were up there at 71%, so significantly higher. And all of the differences between these groups were statistically significant. Looking now towards kind of water use. So 29% of our survey respondents did say they used a secondary source to meet their water needs. However, very few of these were improved sources, so mostly either surface water or some sort of unprotected well or other unimproved sources. One of the things that SCIP tried to promote was household water treatment. It's unclear from project documentation what practices exactly they tried to advocate for, but they did train households in some sort of water treatment practices. In our survey, we found that unfortunately only 15% of households were using a safe water treatment practice. So this is an overall low number, especially when you then look at the water quality findings that we just talked about. One of the upsides of this statistic is that this does represent the vast majority of people who were doing any kind of water treatment practice. So what we've seen in some of the other ex post evaluations is that there will be many more people who are using less effective methods, so straining or letting the water just sit and settle. But here in this evaluation, we found that it was only about 16% were doing anything for water treatment, and 15% were using good practices. So that part was positive. One thing to add in terms of the basic water access, this note here down at the bottom. So you'll see that an average of 29 minutes were spent by households per trip. So right under that kind of 30-minute limit or threshold. One of the things to note, though, is that most households did have to use more than one trip to collect all the water they needed. And so on average, they were spending closer to 68 minutes per day to collect all of their water. So there is just kind of that distinction that we wanted to draw. Now looking ahead to some of the factors that were affecting sustainability. So you'll see on the right-hand side there, 48% of survey respondents overall reported that their primary water point was managed by an active water committee. One of the interesting differences, though, is between communities that had received a SCIP water point and those that had not. So you'll see the blue bar there on the left at 45% was communities that had not received the water interventions from the SCIP activity, compared to the red bar, which is the wash package communities, which were up at 62%. So substantially higher percentage of households reported that there was an active water committee in those communities. Overall, household respondents were pretty happy with how the water points were being managed. So 80% reported that the water points were being managed well or very well. When we talked to the water committees during the interviews, so we found that 6 of the 9 had been formed during the SCIP activity. And kind of talking about some of the key practices that we would expect. So most of the water committees reported meeting at least twice a month. So it was actually quite frequently. So some of them were meeting actually even more than twice a month. And when we talked to government officials, they supported the active water committees as being a key aspect for water point sustainability. They did note that there are challenges with this model, primarily around capacity, as well as the ability to raise sufficient funds. But they did feel that the water committees and them being active was very important for sustainability. And they also noted that they do continue to try and support those health committees as well as the water committees through their activities. Similarly, they did note challenges in being able to do that to the extent that they would like, both in terms of just having sufficient staff as well as funding, transportation, things like that, but that they did try to provide support to the extent they could. Looking now to repair issues, as we noted in functionality and reliability, so repair issues have been a concern. So again, 60% of water points in our observations had some sort of repair issue. Fortunately, around 49% of households, though, say that their water points were repaired within 1 to 3 days, so really pretty quickly. Unfortunately, on the other extreme, though, 12% say the water point was just never repaired. In terms of the types of issues, you'll see in the chart at the bottom there that the largest issue noted was types of breakages. So that's at 20%. So broken handles, pipes, seals, things like this. Other issues like stoppages, low pressure, leaking were much less frequently reported. Moving now on to financial practices for these water points. Overall, we found that tariff recovery was insufficient. So in the household survey, we found that overall 60% of households reported paying water fees. So this is relatively few. You would obviously hope that all of them are paying water fees, but we found about 60% in this case. If you look over at the chart on the right, so this summarizes the annual household water fees. So the vast majority of households were paying flat fees, usually on a monthly basis. We aggregate it up to the annual level. So on average, people were paying around $15 a year. What was interesting in our analysis, though, is once we broke it down by the likely poverty levels of those households, we found significant differences. So those in the poorest group were paying more like $6.50. Those in the middle group were right around the average at about $15. And then those who are likely above the international poverty line were paying closer to $40 a year. No, our evaluation wasn't specifically designed to examine why this might be the case. We didn't know this a priori going in. However, we did try to look at it a little bit. And so there's a few factors that are likely at play here. So part of it may be differences between communities. So communities that on average are poor may be setting water fees at a lower level. In all cases, from what we saw, individual communities were setting their own water fees. So it's entirely possible that poor communities were setting lower water fees than better off communities, and that could be playing into it. We know that's not the only factor, however, based on our survey data. And so, there's also possibilities of perhaps sliding scales within the community. It could have to do with household size, if the fees are set based on household size. And then one of the other big factors to note in what you see here is the data that came out of Kilimani. So Kilimani is the provincial capital in Zambezia, and it's a predominantly more urban setting. People tend to have a few more resources in Kilimani than in the more rural areas, better access to water. And what we found, and we have this chart in the full report, is the disaggregation of annual water fees by district. And so in the Kilimani district, we actually see that annual water fees are up around $50 a year. Whereas when you look at all the other districts, there's some slight variations, but they're mostly on par with one another. And so it's really Kilimani that kind of sticks out. And so that is definitely as kind of being a different type of setting. The more urban setting, people have a bit more resources, are more likely to be in those wealthier kind of groupings, that those are also affecting what you see here. Moving on to the interviews and what we found when we talked to water committees about kind of their tariff collection processes and practices. So 7 out of 9 reported collecting fees, so roughly on par with what we saw in the survey. A few of them cited challenges in collecting those water fees when there were free water sources nearby. So if there was a river nearby or other unprotected wells, the things where people could get water for free, it was much harder to convince people to actually pay into supporting the water points. And then 5 of 9 reported keeping financial records. Now, in none of those cases were we able to actually see any of those records. They weren't either willing or able to produce them for us when we asked, but 5 of the 9 do report having them and keeping them. Moving now on to sanitation access. So overall, this was mediocre. So if you look at the figure on the right, we compare those households who had access to any latrine, so it could be a shared latrine, unimproved latrine, just any kind of latrine, with those who had basic latrine access per the JMP definition. So overall, 52% had access to any latrine, which in and of itself is not very high. But then when you look at basic latrine access at 15%, that's substantially lower. Interesting to note, similar to some of our other findings, we do note substantial and statistically significant differences between those poverty groupings. So those who are likely to be the most poor in the blue bars have the lowest rates of access, only 7% in the case of basic latrine access, whereas those above the international poverty line have much higher access, 43% in the case of basic access. Overall, we found that latrine quality is poor and use is fairly low. So building a bit on the overall sanitation access piece that we discussed in the last slide. So in terms of overall quality, so we observed 500 household latrines, but they were generally poorly constructed using local materials, unsupported pits, things like that. Only 23% had a slab. And in our qualitative data, we've found several people linking the low quality of latrines with low sustainability. That households would use what meager resources they have. They would build a very basic latrine using local materials, but then as soon as a storm comes, and not necessarily even like the major cyclones that we saw last year, but even lesser storms, the latrines would collapse, they would break down, and then the family would be stuck in the position of then having to replace it again, but not having the resources to replace it with a higher quality latrine that might withstand some of these challenges. And so then that latrine again breaks down and you kind of have this cycle. In terms of latrine use, so we found that self-reported latrine use overall was pretty low. And this was a bit surprising in some of the other ex post evaluations that we've done. We find that when you ask somebody if they're using a latrine, there's kind of this positive response bias that they know they're supposed to say yes, and so they say yes, regardless of perhaps whether that's fully true or not. And so then kind of when we compare signs of use to reported use, you often find a distinction there. So in this case, we were surprised to see relatively low, even self-reported rates of latrine use. In terms of safe disposal of feces, for household members 5 years and over, 50% of households said that those members were practicing safe disposal of feces, such as using latrines. But that was higher, 73% for household members under the age of 5. When we asked household members if they knew of anyone in their communities who defecated in the open, 73% reported knowing at least some people who did. And so this demonstrates that while ODF certification may have been achieved during the activity, that appears not to have been sustained in most cases. In the surveys, we did ask enumerators. We didn't do a full ODF verification process or assessment process, but we did ask enumerators when they visited households for the surveys to just kind of look around and see if there was any visible feces in the compounds. There we saw that 91% did not. So that was at least a good sign, but I think in light of this other data, it still suggests that open defecation is still occurring. Moving now to latrine repairs and then challenges faced by households. So latrine repairs and the need for repairs were relatively common. The most common issues were having full pits, issues with the structures of the latrine, walls, floors, the roof. In 51% of cases, the households reported replacing the latrine. However, in 18% of cases, they said they did not. And so depending on the issue, this might just be their latrine no longer had walls and they just continued to use it as is, or it may also mean that they just no longer had a latrine at all. In terms of barriers to access as well as to repair and replacement, so the top two challenges people cited were a lack of money and lack of materials. However, a notable percentage at 12% also noted the recent weather events, so the cyclones and then the associated flooding. Additionally, so some other issues to note that also came out were demotivation. So this is just, some people just didn't believe that latrines were important or that that was something that would really benefit households. Marital status and gender also came out, and here we heard this in the context of, you know, perhaps the wife or mother in the household would want a latrine, but if their husband didn't believe that it was important, didn't want to pay for the materials or pay to have a latrine built, the wife didn't have a choice and didn't have kind of that decision-making authority to change that situation. There's also environmental and geophysical aspects and concerns, so things like the cyclones, as well as kind of the overall topography and geography. And then behavioral considerations as well. So not uncommon for people to cite, well, it's just habit, or that's the culture, the customs, and people just aren't used to latrines, as also being a barrier. And here we just have one quote from a government official that just kind of reinforces this this cycle of poor quality latrines and the need to rebuild them consistently. So he said, the biggest challenge is that the sanitation strategy doesn't give a subsidy for a latrine. What this means is that people in the communities are building with local materials and they're not good quality and they collapse. There are people that are building latrines 3 or 4 times a year. And so you can imagine if people are having to rebuild a latrine 3 or 4 times a year, just that's a significant investment, both in terms of time as well as finances for materials. Even if you're talking fairly basic materials, that's a lot of effort that's going into having to rebuild a latrine 3 or 4 times a year as compared to potentially building a nicer latrine that might last longer once every few years. Moving now on to hand washing. So overall, we found that the tippy taps, which were promoted by the activity, were not sustainable, and that unfortunately hand washing with soap and water was not a normative behavior. So in our household survey, we found that 13% of households had both soap and water available for us to observe. Only 2% of households had a fixed hand washing station, and out of the 822 observations, only 2 were actually tippy taps. And so that just kind of suggests the challenges and community members' beliefs regarding the importance or the utility of the tippy taps specifically. Similar to what I was noting on latrine use, we've found that reported hand washing is much higher than observable behavior. So kind of that positive response bias that I mentioned earlier. So we found that 64% of respondents say that they washed their hands with soap and water yesterday. Now, when you compare that with only 13% of households actually being able to show us their soap and water and where they wash their hands, that's a significant discrepancy. And in our observations, when we tried to look for signs of use, the soap being wet or water spots on the ground, things like that, only 29% of households showed signs of use of their hand washing station. So there are many factors likely affecting hand washing activities. So for the hand washing stations themselves, 58% of households reported repairing or replacing their hand washing materials. In terms of the infrastructure, as I just noted, the tippy tap failure, this is a challenge in hand washing station design, as well as just a lack of perceived value by the community. The community members just didn't see the value, specifically in tippy taps. And so in most cases, tippy taps were replaced by mobile objects, so buckets or bottles, cups, things of that nature. Behavioral factors influencing sustainability are just the general weaknesses with FAST that are now fairly well known. The fixed hand washing station as a cue to action. So as I noted, most households now have some sort of mobile hand washing device. Mobile hand washing devices are better than nothing, certainly, but they don't act as a cue to action. You know, being placed, say, right outside of the latrine, you see it every time you go, you know to use it. That if mobile objects just can't be that same cue to action. And then similar to what we noted on the latrine use, some households just didn't appear to value hand washing. And so when we would ask questions about, you know, why people may not wash their hands, it's just not seen as important or beneficial, and so people don't do it. When we talk to government officials, they did talk about ongoing support that they try to provide to the communities regarding hand washing and other wash behaviors, and then also to the health committees and the water committees actually as well, through independent agents, so independent consultants, so actually contracting with the private sector to provide some of this support. So that is something that they're continuing to try to support communities. But as I noted earlier, they do also cite challenges in being able to do that or provide that support to the extent that they would really like to. When we asked households what factors were kind of constraining hand washing activity, you'll see in this chart here, there's several different factors. The number one was limited finances. And the interesting thing to see here is just kind of some of the differences between those likely poverty groups. And so you can just kind of see both in terms of limited finances, but also some of the other options like access to soap and water in the compound, or hand washing station quality, just kind of some of the differences between those poverty groupings. Through the interviews, we found very similar results. So the interviews also echoed these kind of broader financial and resource barriers, and then also noted that financial resource allocation and decision-making power, kind of going back to the similar latrine issue where women don't necessarily have the ability to make decisions about resource allocation and deciding to go buy soap or invest in, you know, hand washing materials. That's often the husband's responsibility, and so it depends on whether the husband believes that it is something important. Moving now on to talk about the effects of the community health committees that were either created or strengthened through the SCIP activity. So overall, 94% of household respondents said that their health committees were effective. So very broad support. And 52% also said that they attend health committee meetings. Through the interviews with CHC members, 8 of the 11 health committees considered themselves active, though the one no longer existed. 5 out of 6 district officials reported that their offices continue to provide support to these health committees, but at varying frequencies, kind of speaking back to some of those challenges that I noted earlier. In terms of the role of women in these health committees, so all of the health committees we interviewed included women and at least reported that the women were actively participating in meetings and decision making. However, when we looked at the specific numbers of how many women on the different committees and what roles they're playing, so we found overall about a third of both health committee and water committee members were female, but we found that few of those members held leadership positions, such as being the president or the head of the committee. So, I mean, based on this, I mean, overall, we find that these committees are still generally active and they're viewed as effective by their communities. However, I do just want to go back to some of the findings that we found in water, sanitation, and hand washing that weren't as promising. And so, though it's entirely possible that these health committees are kind of preventing slippage and are helping to at least maintain a certain status in terms of good WASH practices, it doesn't appear that there's a lot of positive progress being made. Moving now to SCIP's integration. So going back to the discussion of implementation, so SCIP really tried to have kind of an integrated approach across sectors. Having the WASH activities integrated with nutrition and some of the business development pieces. Unfortunately, we found that there's limited documentation on how integration happened as kind of a concrete and practical matter, and kind of what that looked like in implementation. When we talked to communities, they all expressed appreciation. They liked that the activity worked in different sectors and tried to help them not just in one area, but in multiple areas. But when we talked to implementers, they did note a number of coordination challenges, especially where different organizations were responsible for different aspects or in different areas and zones, that it was actually difficult to kind of keep it all truly integrated throughout implementation. And then we also heard that WASH itself wasn't fully integrated until the no-cost extension period. And just a note here that the communities involved in the no-cost extension period, because it was substantially different from what was done throughout the bulk of SCIP implementation, was actually excluded from this ex post evaluation. We also saw there's a 2012 process evaluation for the SCIP activity, and they noted significant challenges in coordinating and integrating across sectors, across entities and implementers. So echoing what we heard from the IPs. And this is somewhat similar to what we often see in integrated programming, is that it does end up being much more challenging to truly integrate the timing and the different activities, the different implementers and stakeholders, and who believes what are the priorities, and really make sure that all those things are aligned. And so often it ends up similar to what we saw in SCIP, where integration probably was likely not as well implemented as hoped or planned. Moving now to resilience. So we did find that 53% of households reported that their communities were somehow impacted by those recent cyclones and the associated flooding. What we saw in terms of the different types of impacts, so 31% reported some type of water contamination, 21% reported issues with drinking water access, 21% reported issues with sanitation or latrines, and 11% reported issues with hand washing stations. What was interesting when we did the interviews and we asked about the effects of the cyclones and flooding, the number one issue those people cited were actually sanitation related issues. So latrines collapsing, things like that. In those interviews, 10 out of 11 of the health committees and 8 out of 11 community member interviews reported that their community had been impacted by the recent cyclones and weather events. In the CHC interviews, we did hear reports that some of the communities were still recovering, even several months after the cyclones had hit. Looking at the effects of these weather events on wash sustainability, so the chart on the right just kind of shows, using the scales in red, the extent to which households had reported cyclone-related issues in their communities. In terms of the specific effects, so 44% of survey respondents said that the water point problems had been fixed, so less than half of the water point issues had been remedied. However, 78% said that they had repaired or replaced a hand washing station, so much higher than the resolution on the water issues. In terms of sanitation, we heard that 50% of respondents reported community members openly defecating post-disaster. And so that was an additional challenge. Now, with the community health committees as well as the water committees, we might have expected that these committees should be playing a role in helping the communities resolve issues after a significant shock like these cyclones. However, what we saw in the interviews is that 29% said their health committees had helped the community, and only 23% of water committees had helped the communities really kind of come back and resolve issues after the cyclones. Moving now to recommendations that came out of this evaluation. So number one was to promote alternate sanitation approaches to a pure, no subsidy, CLTS only approach to ensure that financial barriers to basic sanitation access and latrine quality are addressed. Number two, explore alternative modalities of working with host governments and local community agents to provide more effective ongoing WASH behavior change support to communities as one of several components aimed at prompting behavior change. Number three, work with service authorities to strengthen and increase the frequency of water quality testing and treatment practices for rural water supply. Number four, consider alternate approaches to small community managed water supply. Number five, investigate the impact of local government outsourcing of WASH support to the private sector. Number six, replace tippy taps in project design with hand washing station models that are durable, aspirational, and responsive to the local context. Number seven, incorporate resilience planning for rural WASH investments to enhance sustainability, particularly where recurrent shocks are a risk. And finally, number eight, encourage implementers to keep thorough documentation regarding key aspects of implementation, particularly regarding cross-sectoral integration. And just as a final slide, we'll get to questions and feedback here in a moment, but I do just want to take a moment to thank our entire evaluation team, my colleague Holly Dents, who led our team, Basilar, Andrew, Grace, and Leslie as well. Thank you to everyone who supported this evaluation. With that, I will turn things back over to Abby for next steps.
Thanks, Kari. Before we open it up to our Q&A portion of the event, I'd like to turn it over to Maggie Northman, who leads the WASH team at USAID Mozambique for reflections. Maggie.
Thanks, Abby. Hello, everyone. It is great to have an opportunity to provide some insights from the USAID Mozambique's mission perspective in this webinar, and we're excited to continue the conversation on how to strengthen our WASH programs moving forward. I wanted to highlight 4 of the recommendations from the evaluation and talk about steps that we're taking on the mission to include these recommendations in our future programming. The first one, water point functionality and reliability continues to be a huge problem. As the recommendations highlighted, we will be considering alternate approaches to small community managed water supply and explore new management models aimed at creating a professionalized rural water service provision. For instance, the government of Mozambique has been testing and scaling up private sector management of piped water supply in rural growth centers and small towns. So USAID will build on these experiences, as we are already doing with our WashFin project. One key challenge, however, is the insufficient fees collected to cover operation and maintenance costs that could help maintain adequate water services. In many cases, these fees are not enough to cover these costs, so it will be important for USAID to work closely with the government, the private sector, and other development partners to design a program that could provide ongoing support and monitoring. The second recommendation, sanitation results from this evaluation, unfortunately, do not veer away from many other evaluations done in the sector. While quality of materials remains a concern, financing continues to be a big barrier in increasing access to improved sanitation. Moving forward, the mission will focus on sanitation as well as financing aspects of it. We're looking to build on work of other partners that explore different forms of financing for households to improve their sanitation situation, including revolving funds, for instance. How we do this at the national level is something we would like to explore moving forward, along with improving the sanitation markets, particularly for people who are able to afford better sanitation products and are willing to pay for them. Thirdly, behavior change continues to be a formidable challenge, not just in terms of hand washing, of which the uptake is quite low and is a critical conversation today in terms of COVID prevention, but also in terms of other behaviors such as proper water storage. Water quality issues need to be addressed. The findings from this study are consistent with an MCC impact evaluation published in 2014, which highlighted high levels of water contamination post-water collection, pointing to poor water storage practices in rural Mozambique. Changing these practices require robust behavior change interventions, as well as more close collaboration with the government. USAID supports the government-led National Rural Wash Program, which is called PRONASAR, and we hope to be able to contribute more to tackling these behavior change issues, as well as the first two recommendations related to water and sanitation that I just previously mentioned. And finally, resilience. We assume that water and sanitation will continue to be impacted by extreme weather, climate change, and civil conflicts in the north. USAID Mozambique is designing a new WASH in addition to other projects with specifically adaptation and resilience in mind. In conclusion, ensuring sustainability of WASH services remains a huge challenge that we aim to tackle in our current and future programs. This is definitely in line with USAID's Global Water Strategy's strategic objectives that promote sustainable access of safe drinking water and sanitation services, and the adoption of key hygiene behaviors and strengthened governance, financing, and institutions. These are very much aligned with our new Mozambique WASH high priority country plan. Multi-sectoral programs are a key priority for the agency, but the SCIP evaluation, as well as studies of other integrated programs, shows that this cross-sectoral integration likely did not have the intended effect on outcomes for sustainability. Part of the issue is the limited documentation, which prevented a deep dive into the effects of SCIP's multi-sectoral integration. But perhaps there are other factors that led to this, and we need to be better at documenting and benefiting the cost of such integration that we strongly promote in order to make sure that it really helps achieve the development outcomes we want. Thank you so much for your time, and I will hand it back over to Abby.
Thanks, Maggie. So I think during the presentation, we had a number of questions come in. Please feel free to continue populating that and engaging as you see fit. But we'll start, I guess, with some of maybe the easier questions that came in around methodology. Kari, there were questions about whether or not we had comparable end-line data to compare ex post to activity end-line, as well as selection criteria used to decide which communities received the water interventions. So if you could answer that, that would be great.
Sure. So to the first question on kind of project data that we can compare to. So there was a baseline survey that was done as well as an end-line survey. Now, in our report, you will see some comparisons with this data. However, I do want to note that direct comparisons aren't possible, and this is in part how we selected our communities to visit. So as I noted, for instance, we excluded the no-cost extension period, and we also excluded areas, communities where we knew that there was substantial other WASH programming. And so because of the differences in how we sampled communities, the comparisons back to those baseline and end-line data points aren't they're not directly comparable, but just kind of for reference purposes, we have included those in the report. I will say overall, there wasn't huge improvements, some improvements in self-reported behaviors, but overall there weren't significant changes in most of the indicators since the project had ended. In terms of the second point, asking about how the activity selected where water points would be installed. So we don't know the full details. We only have a few points that are included in the project documents, but from what we understand, it was need-based. And so for instance, a community that already had a number of water points, particularly protected water points, may very well not have been chosen. And so they would have gone to communities that expressed higher levels of need. So that's, we don't have a lot of details on how that selection process happened, but that's the basic gist of it.
Thanks. There also, I think, given sort of the staggering water quality results that emerged from this ex post, there were a number of questions that came up on water quality. Those ranged from, so like, who is supposed to be testing these water points for water quality? How often is this testing supposed to be done? How do the communities end up dealing with contaminated water? Was there actually any water quality results from activity endline that you were able to compare during the ex post? And then were you able to disaggregate between the types of water systems, the water quality that emerged? So like a hand dug well versus a borehole. Sorry, I know there were quite a few questions there, but I think there's a lot of interest.
Yeah, absolutely, no worries. I was taking notes as you were going through the questions, so hopefully I hit all the points, but please remind me if I miss any. So in terms of who is supposed to be testing, so this is supposed to be the local governments. And we did talk to the government agency that is responsible for this. They did talk about being able to conduct some water quality tests. And actually what we heard from them in terms of the proportion of water points that they test appeared to be much higher than what we heard from actual communities and from other entities. I think if I remember correctly, they reported testing something like 60% of water points. I think based on what we've heard, it's happening much less frequently than that. When we talk to people at the community level, in most cases, water quality hadn't been tested since the water points were originally built, or it happened very sporadically. Maybe they came back once and tested it at just kind of a somewhat random interval. And I think this goes back to a lot of the challenges that government officials expressed in terms of just having sufficient staff, having sufficient resources for all of the different testing materials that they needed, as well as transport to get to all these communities. You know, especially some of these communities are very rural, they're harder to get to, et cetera. And so those were some of the challenges that they cited in not being able to do as much as they would like to, or perhaps even should be doing. So I think that kind of gets to both who is supposed to be doing it, but then also how often. So it should be happening much more often, but as a practical matter, it's not able to happen as often as it should. How do communities deal with it? So, I mean, it all depends. When we talk to some of the government officials, they mention not having a lot of authority to actually take action to support the communities, beyond kind of encouraging them to treat the water sources. And so I think a lot of the responsibility ends up just kind of de facto falling to the communities to deal with it, which most likely means that not a lot is done, even where they know of an issue. To the question of any end-line results, so in terms of water quality, we do not have that data. That was not something that was collected in the end-line data. In terms of disaggregation by the different types of water systems, so we have a relatively small sample size with 46 water points. We did try to take a look at differences between the different types of water points, but we didn't see any differences. Now whether that's because there actually weren't any differences or if there just weren't enough of each of the different types of water points to show something that would be statistically significant, you know, it may be somewhere in the middle there. But no, we didn't see in our data anyway any differences by type of water system. Just to reemphasize though that all of the water points were those AfroDev water pumps, so they were largely similar, either being hand dug wells or boreholes.
Well done, Kari.
Did I hit all the points? All right.
Yeah, well done. I think there were some other water questions, but I think maybe we should move to some sanitation questions and then circle back. You know, you mentioned that financial and material barriers were some of the primary reasons why the communities you observed didn't have basic latrines, but can you kind of unpack some of that? I think this continues to be an issue that plagues many of us in the sector, and we'd love to understand a little bit more on basic latrine access.
Yeah, so to be honest, I mean, we don't have precise data on this, but the inclination based on what we've seen, not just in Mozambique here, but in the other series, is that yes, financial concerns are commonly cited as a constraint. How much, and obviously we are talking about relatively poor communities in most cases, and so you know we don't necessarily doubt that you know financial challenges are an issue, but I think a potential intervening factor there is also this question of importance, and so I think this came out particularly in the SCIP evaluation, where we had people who just plainly told us we don't think this is important, and so it's not worth spending their limited resources on it. That latter part isn't necessarily said, but I think that may also be a factor. You know, limited resources are kind of a given, but we do see some differences, especially you know across different areas, where when people believe that it's important, they may be more willing to dedicate some of their limited resources to that need. And so there is kind of a interplay there. I think the other question, and I don't know that we have a definitive answer on, you know, this is the path forwards and it'll work and it'll fix all of our problems in the wash sector, but this question of subsidies. So this has come up in the last couple of evaluations. So first the PEPM evaluation in Senegal, and then here in the SCIP evaluation is the question of you know the no subsidy, the pure CLTS approach, and whether there might be some benefits to having some sort of subsidy. No, we don't, from our ex post series, have enough data to be able to say exactly what that should look like, and so we've kind of encouraged USAID to look into this more and kind of experiment with different options. but that is something that comes in as well. I don't know, Holly, if you have anything you wanted to add, or also open it up to Abby or others on the USAID team if there's kind of additional points that we kind of want to go into more depth on regarding those financial concerns.
I think you've covered it well. I'd be happy to answer if there's any follow-up questions to what you said, Kari. Abby, back to you.
Yeah, a few questions have come in on sanitation marketing, which is somewhat related. I know that didn't come up in your recommendations based on what you saw in the ex post. Wonder if you have any thoughts on that. No problem if not.
So yeah, so this marketing question, at least from what we can tell, was kind of less a part of SCIP than perhaps some of the other evaluations in the series, and kind of the demand creation aspect. Obviously there's the CLTS aspects and building demand through that, but PEPM, for instance, did additional aspects of trying to train and hire masons and do other types of activities to try and beef up demand. But I think in the SCIP case, that seemed to be less of a focus.
Yeah, and they did try to set up spare part suppliers, but that was the closest thing that happened related to any sort of support for the sanitation piece as well. Back to you, Abby.
Maybe this is a good moment then to transition to some of the questions that have come in on finance, which are largely, I guess, related to water points, but I know bear on sanitation as well. Some of the specific questions that came in were related to who like collects the tariffs, who owns the SCIP water points, like were they effectively handed over? Is the amount annually collected sufficient to cover maintenance expenses? Based on your previous findings, I guess I would wager they aren't. Is the amount collected on par with what the committee anticipated needing? So we'll start with those.
All right. Again, I've tried to make notes to myself, but please remind me if I've missed any of those points. So maybe to start with the ownership question. So, I mean, from what we can tell, the local communities and the water committees have ownership and responsibility for managing the water points and at least doing basic maintenance and basic repairs. Now, it was something that, and this will come out, I think, more strongly even in our ex post synthesis, but there are some challenges with that. Even if, per, the letter of the law and the rules, are somewhat clear, de facto what actually happens tends to be a little bit messier. And so, the government, for instance, reports trying to support the water committees and supporting kind of more major repair issues when they arise, but that doesn't always happen. In part, do they, how much information do they actually have access to in terms of what water points are where and which ones are functioning? When we talk to government officials, this information wasn't often readily available and not up to date. And so, if they don't even necessarily know the status of all the water points in their zone, you can understand how it would then be difficult to keep up, even if you had unlimited resources, being able to keep up with supporting the water committees on all of their needs. They do try to do as much as they can, but as we noted, there are some constraints and lack of resources and lack of staff being a couple of the primary ones that they've cited for providing that support. In terms of kind of water fees and ability to collect those fees, so I mean, as we saw in the data, only 60% of communities are actually even collecting fees. So already 40% are running deficits. They don't have enough money to do even basic maintenance, let alone repairs. Where fees are being collected, so what we saw based on how much people reported that they were paying is that, I mean, it's hard to say whether that's actually sufficient. When we talked to water committees, they often noted it was not sufficient. But it was less clear if it was an issue of where the water fees were set, like are the water fees just set too low? Certainly, I think in some cases that is the case. As I mentioned, it's on a community by community basis that these committees and their respective communities are setting water fees. And so if people are only willing to pay a small amount, that may be all that the water committees can get, and they'll take what they can get. And so I think it varies a bit by communities, but generally what we heard is that no, what they're able to collect is not sufficient. And to the actual ability to collect the water fees. So obviously where water fees are set and the amount each household is expected to pay is one thing. Actually being able to collect them is another thing. And so though it is the water committees who are responsible for collecting those water fees, varying levels of water fee collection were reported. I mean, we weren't able to access like specific statistics, 60%, 70%, things like that. Most of the committees didn't have that level of detail. But as I think we noted in there in the one case, or reported in several cases where there are free water sources in addition to the water pumps, that those were particularly challenging situations for them to actually collect water fees, regardless of what level the water fees were set at. Just convincing people to actually pay for it when they could go to an alternate source that's free was challenging. And then the last piece was, that was the amounts compared to what's needed. So yeah, unfortunately, they are generally falling short, it would appear. Did I hit all of the points, Abby?
Yeah, thanks, Kari. I think there's also a lot of interest too in integration and kind of what you learned from that. I mean, I know that aspect of the evaluation was challenging given documentation shortcomings at Endline. But I think there is some interest, and maybe you have some insight in like helping us understand how we might track integration, knowing what you know now, like what we could have put in place to track that better. And then
sure.
I think also a question, sorry, this is more of a layup. Can you remind us what sectors SCIP was meant to integrate?
Sure. So just I'll probably answer the easier one first. So in terms of the sectors, so this included health, HIV, AIDS, nutrition. There was some kind of small business, productive activities support, WASH, nutrition. I believe those were the ones, the primary sectors that they focused on trying to really integrate. in terms of kind of what we learned, so as you noted, Abby, one of the primary challenges we faced is just a lack of information on how it was done. What did that integration look like? Was it one person who was going out to the community and responsible for doing all the different activities, or was it different people who are responsible for different aspects, different organizations even? I think in the SCIP case, it does look like it was often different entities and different people who were responsible. And so that in and of itself, it creates some challenges in just making sure that all of those different teams and all of those different people are kind of on the same page. I think, to kind of the overall coordination challenges, and, part of it is on the implementation side, but I don't want to put all of it just on the implementers, because it's also a matter of stakeholders. As soon as you start bringing in lots of different sectors, now you also have lots of different government ministries, for instance. And this can vary by country and how things are set up, but you might have whoever's responsible for water services. So sometimes that, and often that's different from who's responsible for sanitation and hygiene issues. You might, if you're trying to bring in other sectors, well, then now you potentially have yet more government agencies. And so you have to bring them into the fold and get them, kind of also aligned in terms of everybody's priorities and, their focus, and kind of get everybody integrated. And that ends up being kind of a major challenge. And this is something that's been seen not just here in the SCIP context, but something we found in the broader literature as well regarded integrated programming. The kind of the analogy of kind of the spinning plates that are up in the air. As soon as you start adding more and more plates, it just gets that much more difficult to make sure all the stakeholders are aligned, the timing of the different interventions are aligned, and that it makes sense to do this activity before that one, and make sure the implementer is ready to do activity 1 before activity 2, and just making sure that all of those pieces are aligned. That just ends up being a major challenge for integrated programs.
Thanks, Kari. It seems to me that in light of COVID-19 response, it might be worth circling back to this finding around tippy taps and the use of hand washing with soap and water. Do you mind kind of walking us through or trying to unpack a little bit more the findings around fixed hand washing stations and what we might want to think about in the future?
Sure, and Holly, please feel free to jump in as well. I mean, basically, what we found here, and this is similar to some of the other evaluation findings in the ex post series, is that there is a lot of reversion to mobile objects. The fixed hand washing stations continue to be a challenge. I mean, the tippy taps themselves in all of our evaluations have largely been unsustainable. That we've found very few when we've gone back, several years later. And part of this has to do with design and just community members' thoughts and perspectives on the importance of the tippy taps. I mean, partly obviously it's just the importance of hand washing in general, which in the SCIP case we found even that was a challenge. But then kind of the utility of the tippy tap model itself.
Can I just jump in, Kari? I think it's also, I think you've danced around this, but it's the quality of the hand washing stations. People come back to them time and time again. I know that one of the appeals to the tippy tap is that it's low cost. It's traditionally made with locally available materials and using jerry cans and what have you. But I think it's the quality. They don't last last, and then the time it takes to rebuild them. The jerry cans are either repurposed or, break because of some damage if they don't have UV protection, etc. And so, hand washing behavior, I think, as many of us know, is very difficult to have people buy into and practice consistently in general. And then when you add in a tippy tap and something that's breaking down, it actually ends up becoming another barrier, and why you see that reversion back to pitchers and basins and other mobile hand washing devices. And so it's pretty clear, though, coming out of this Expo series, that tippy taps are not a sustainable long-term solution to hand washing, and making sure that hand washing with soap is able to be practiced in these rural settings, at least. And so, that's why our recommendation is pretty clear, that there needs to be an alternative to tippy taps, and there's different thoughts on what that should look like, but certainly it's pretty clear that for long-term sustainability, tippy taps are not the answer, and are not going to be able to facilitate that behavior consistently. Abby, back to you.
Thanks. Yeah, that makes sense, and I know it's something that's come out quite strongly in these evaluations, including in this particular ex post. And I think something we need to think very hard about, especially as we kind of continue trying to respond to COVID-19 in both a timely way, but also in a way that promotes lasting behavior change. There are lots of very specific questions that people have posed related to the study. And I guess for those, I would strongly urge you to look at both the brief and the full evaluation report, which, as I said, are available on globalwaters.org. There were a number of questions actually related to water point management and alternative management models. Harold helpfully pointed to a number of other products that USAID has produced, including with his help under our Sustainable Wash Systems activity, SWS, which I hope everyone can see in the chat box, but are also available on globalwaters.org. Kari, do you want to speak at all to kind of the management model recommendations? I believe there was a recommendation in this SCIP evaluation on management.
Yeah, and it's a similar recommendation that we had, I believe, in the Ethiopia case as well as Senegal. And I think this is something broader in the literature, and will certainly come out in our synthesis as well, is just some of the inherent challenges with the community-based management model. Challenges with the capacity of the members, challenges with collecting sufficient water fees, and the associated impact on sustainability of those water sources. I mean, across all of our rural water evaluations, we found substantial percentages of the water points where we're no longer functioning, and that only gets worse with time. So in the Senegal case, the rates were somewhat similar to what we saw here in SCIP, with around 65% of the water points being functional. In the Ethiopia case, which was conducted closer to like 8 years after the activity, I think it was more like, and I apologize, don't quote me on this exact figure, but it was more like 30 or 40% were functioning at the time of our visit. So obviously with age, it only gets harder. In terms of alternate models, so I mean, it wasn't really in the scope of our ex post evaluations to kind of do that broader kind of literature search in terms of what should be done. So in each of those three that I noted, they were all voluntary local community-based organizations that were responsible for managing the water points. And so we don't kind of have that comparison point of kind of alternate models that might have been more effective, and we could look at the relative sustainability or not between the different models. That being said, I mean, we do, particularly in the synthesis that will be coming out, draw on a lot of the broader literature that's looking at kind of professionalization of rural water points, possibilities of bringing in private sector opportunities to better support operations and maintenance. I mean, in the ex post series, there were some small efforts to integrate private sector support. So in the SCIP case, this was relatively small. It was kind of these parts suppliers that the activity tried to promote. Unfortunately, those were not sustainable. In the PEPM ex post evaluation in Senegal, we found kind of mixed reviews. So there they trained and helped create both water point drillers as well as organizations who could provide maintenance and repairs. We found that not all, but many of the organizations that were supported were still active and still working. However, the activity had tried to put in place contracts to kind of guide the process through the future, and there was kind of set fees that the water committees would have to pay for these services. Those contracts kind of fell by the wayside for a variety of reasons. In part, sometimes the water committees didn't pay what they were supposed to pay. Sometimes the companies had difficulties providing the full services they were supposed to provide. And then there was also competition with other providers, just companies that hadn't been supported by the activity. And so there was kind of ad hoc support being provided. You know, a well breaks down, and so they call somebody and he comes and fixes it, and then that's kind of the extent of the interaction. So there was kind of mixed results there, in that they were still in existence generally. They were still continuing to work with communities, and there was demand for their services, but it wasn't quite the kind of organized contractual process that had originally been envisioned. So, I mean, those were just kind of some small examples that we saw here in the ex post series, but those are certainly types of things that are worthy of exploration. And so, yeah, there's a number of things that are kind of worthy of exploration and kind of testing out what exactly should it look like if we change this facet or that facet. And but from what we can tell, and certainly from the ex post series, we don't unfortunately have a definitive answer. And I wish I could say this is the way forward. This is exactly what we should all do. But unfortunately, I think our best recommendation is to continue researching, look at those alternative models, test them out, continue to figure out what works best and what might be more sustainable than the community-based management models that we saw here in the ex post series.
Yeah, thanks, Kari. And I suppose it hardly needs an additional plug, but just one more time. Please be on the lookout for a forthcoming synthesis report that sort of ties all of these 6 evaluations together and tries to distill some key findings across very, very different contexts, but all around sort of similar themes that we discussed today vis-a-vis SCIP. So with that, I'd like to turn it over to Maggie for one final comment, and thanks everyone.
Thanks, Abby. I just wanted to put one plug out there. Yesterday, we published on BetaSam and on our USAID Mozambique Facebook page a request for information that we sent out for our new Transform Wash design. So this is a new flagship water sanitation and hygiene project we're designing. And we wanted to really get some feedback from different potential partners and anyone interested in how to make it the most effective and best project that we can put together. So if anyone has any interest, please go ahead and find it. It has a 3-week window to submit a 2-page response to answer some of the questions that we're looking in for our new designs. And with that, I just want to thank everyone, particularly Abby and the entire design team, evaluation team rather, for putting together this presentation. It's been very useful for us in the mission, and I hope it's been useful for everybody else listening today. Thanks everyone for your time, and have a great day.
Bye, thanks everyone. Thanks so much for joining.